We are going to start with a session about future trends. So you've seen what has occurred in history. We want to tell you what's happening in the future, and we want you to be able to get ahead of it. We have about 7 key trends to share with you. The first trend really is the ability to access healthcare. So the public system is lagging. Your employees are struggling to find treatment. So the virtual access and navigation of the healthcare system is helping. The thing that I want you to know about in terms of this is that benefit plans and wellness plans are now becoming more about helping an employee find their way through their health issue. This is the first of many comments from experts that we've talked to. Some of you might know Dr. Greg Wells. Let's hear what Greg has to say about this next trend.
We're seeing a proliferation of technology in our world, and what's going to happen is that we're going to see a merger between humans and tech, which can lead to a ton of data, which can be confusing and paralyzing. However, if we use wearable tech to help us understand where we are at when it comes to our sleep, our physical activity, our stress levels, and when we see those numbers change for the better, I really feel like that can help us to navigate this world of too much information.
This next commentary from Joe O'Connor speaks to the idea of a more flexible and autonomous work environment.
HR leaders and talent professionals are currently faced with a variety of different choices when it comes to designing the right flexibility model for their business. Some are opting for total flexibility, and on the face of it, that sounds fantastic. But often the downside of these kind of unstructured flexibility approaches lies in the fact that the access to and the distribution of the benefit can be very uneven. The virtue of the shorter working week lies in structured flexibility.
Flexibility is everything with work, autonomy, having control over how you work, but it also fits within the benefits and wellness world. So I think we need to guide our employees to find the right things, but also do it within certain limits and boundaries. Trend 4 is that the cost of claims are rising. Now, the 2 big drivers that we follow a lot in the drug category would be the new drugs that are coming through the pipeline. Many of them, the newest ones, are $500,000. So can you afford to have that on your benefit plan? Overall, claims are going up, costs are going up. So be prepared and make sure you model that properly. Communicating with your employees is getting more difficult. So we have to get a lot more creative with how to get their attention. The administration of a plan is challenging, and most people who are tasked to do it aren't trained to do it. And they're now dealing with great technology to help them, but when they have to actually call an insurance company to ask a question, they're in the queue, and like calling a bank, you could tend to get frustrated. Our job has gotten even more significant because we deal with a lot more queries, so we have to come to the rescue and solve put out a lot of fires as a result. So the last trend, not a surprise, is employee well-being. It's one of the top things that they look for when they come to work for you. But what's happening is that benefits and wellness is starting to integrate. And the beauty of vendors that consolidate, that's happening, which is a good thing because you're starting to get your employees to go through one door where they can get everything. So you have to, in my opinion, you have to guide people to find the right information and really curate the inside and outside experience as best you can.